A natural diet is not just about what you eat every day, it's a lifestyle that impacts your overall well-being. Diabetes, a chronic condition closely linked to daily habits, requires more than just regular medication once diagnosed. A well-planned eating structure is vital for stabilizing blood sugar and preventing complications. In this video, we'll break down how to find your stabilizer in everyday meals by exploring 4 key categories: staple foods, protein sources, green vegetables, and selected fruits. Learn how to mitigate the dramatic blood sugar swings that can impact your health. 1. Whole grains and mixed grains, gently releasing energy for steady blood sugar. When it comes to staple food choices, whole and mixed grains are far superior to traditional refined rice and flour products. Foods like quinoa, millet, whole wheat bread, and sweet potatoes are rich in natural dietary fiber and complex carbohydrates. These nutrients help slow the breakdown and absorption of carbohydrates, ensuring that blood sugar rises gradually after meals. In contrast, highly processed foods can cause a sudden surge in blood sugar, which over time may overload the pancreas and lead to a host of metabolic issues. Example: Mr. John, a 72-year-old gentleman, used to eat white rice or refined flour at every meal. Per his doctor's recommendation, he began replacing some staples with quinoa, sweet potatoes, and a multigrain porridge. After a while, Mr. John noticed less post-meal fatigue, more stable blood sugar levels, and a significant drop in his HbA1c during checkups. Shopping tips: choose grains that haven't been overly refined. Look for packaging labeled whole grain or rich in dietary fiber. Cooking methods: emphasize steaming, boiling, or making porridge, low-heat cooking methods that help minimize nutrient loss. Pairing suggestions: combine whole grains with high-protein, low-fat dishes to create a well-balanced meal. 2. Premium protein, repairing the body and moderating blood sugar levels. Protein is crucial for repairing our bodies and supporting various physiological functions. Compared with high-sugar carbohydrates, premium proteins provide lasting satiety and help regulate insulin secretion, thus indirectly keeping blood sugar levels in check. Premium proteins come from both animal and plant sources. For instance, chicken breast, deep-sea fish, tofu, and other soy products are low in fat yet abundant in the essential amino acids our bodies need. These foods release energy slowly, preventing rapid spikes in blood sugar. Additionally, a balanced protein intake can slow gastric emptying, resulting in a more gradual post-meal blood sugar rise. Example: Ms. Emily once struggled with sudden blood sugar spikes after meals. Gradually, she replaced red meat and high-fat foods with lean proteins like chicken breast, fish, and tofu. Within 3 months, she not only lost some weight but also achieved more stable blood sugar readings, helping her regain confidence in her diabetes management. Daily practice: rotate your protein sources by incorporating fish, poultry, and soy products instead of sticking to a single type. Cooking tips: use methods such as steaming, simmering soups, or braising, and try to avoid deep frying or heavy oil-based cooking. Portion control: include a moderate serving of premium protein at each meal to avoid placing additional stress on your liver and kidneys. 3. Green vegetables, a natural treasure trove, fiber to support blood sugar regulation. Vegetables bring a refreshing crunch and a wealth of nutrients that make them indispensable at every meal. Especially important are leafy greens and cruciferous vegetables, which are loaded with vitamins, minerals, and dietary fiber, natural allies in blood sugar control for those with diabetes. The fiber in vegetables slows down the digestion of carbohydrates, helping to maintain a steady blood sugar level. Moreover, antioxidants and phytonutrients in these foods can reduce chronic inflammation and boost metabolic health. Example: Mrs. Linda, aged 68, used to consume an oily diet with too few vegetables and often felt sluggish after eating. Under the guidance of a nutritionist, she began adding a generous serving of seasonal vegetables, such as broccoli rabe, cauliflower, and lettuce, at each meal, with just a drizzle of olive oil for flavor. A few months later, she experienced more energy, and her blood sugar readings from routine tests showed clear improvement. Daily intake. Aim for at least 300 grams of various vegetables each day to meet nutritional needs and help stabilize blood sugar. Variety is key. Incorporate a rainbow of vegetables, red, green, yellow, to ensure a diverse nutrient intake. Cooking methods. Whether eating raw, lightly stir-fried, or in a salad, try to minimize salt and heavy seasonings to preserve the natural flavors and benefits of the vegetables. 4. Select low-sugar fruits, satisfy your taste buds while preventing blood sugar spikes. Fruits are naturally nutritious, yet they also contain fructose, so choosing the right ones is crucial for diabetes management. For optimal blood sugar control, focus on fruits that are low in sugar and high in dietary fiber, and be mindful of when and how much you eat. Opt for fruits like pears, kiwis, strawberries, and dragon fruit, which generally have a lower glycemic index and pack plenty of vitamins, minerals, and antioxidants. These nutrients not only fulfill your dietary needs but also help combat oxidative stress and delay rapid blood sugar increases. Moreover, the fiber in these fruits aids digestion, promoting a balanced sugar level throughout the day. Example, Mr. David used to indulge in large servings of tropical fruits after meals. After advice from family and his doctor, he began strictly controlling the type and amount of fruit he consumed. By replacing high-sugar fruits with lower-sugar options and reserving them as mid-meal snacks, Mr. David experienced enhanced insulin sensitivity and a much more stable blood sugar curve over several months. Timing. Enjoy fruit as a small snack between meals rather than on an empty stomach or immediately after a meal to avoid dramatic blood sugar fluctuations. Portion control. Aim for about 100 to 150 grams per serving, enough to savor the natural sweetness without overloading your system with sugar. Pairing options. Consider combining fruit with a handful of nuts or a serving of yogurt to boost satiety and further slow down sugar absorption. 5. Healthy pairing and daily management, the details that make all the difference. Maintaining stable blood sugar isn't possible by relying solely on one food group. A balanced diet, mindful portion sizes, and a regular exercise regimen are all essential for effective diabetes management. Keeping a food journal. It's advisable to track your daily food intake and monitor your post-meal blood sugar levels. Detailed records can help you spot patterns, adjust your meal plan, and discuss your progress with your doctor or nutritionist for tailored advice. Beyond diet. In addition to healthy eating, regular physical activity, adequate sleep, and stress management are critical. Daily activities like walking, practicing Tai Chi, or performing simple stretching exercises can boost insulin sensitivity. Moreover, maintaining a consistent sleep schedule and managing your emotional well-being all contribute to a comprehensive health management system. Example, Mr. Robert, who had battled poorly controlled blood sugar for years due to erratic eating habits, turned things around with the help of a nutritionist. He started following a detailed weekly meal plan and incorporated a 30-minute walk into his daily routine. Furthermore, he joined a local support group for seniors with diabetes, where he shared experiences and learned new management tips. After several months, Mr. Robert saw significant improvements in his blood sugar control and overall quality of life. Every natural food comes with the wisdom of nature's own health benefits. By carefully selecting and combining foods from the categories of whole grains, premium proteins, vegetables, and fruits, diabetes patients can achieve both stable blood sugar and balanced nutrition. Whether you're opting for whole grains in place of refined carbohydrates or prioritizing lean, high-quality protein in your meals, these seemingly small changes can lead to major improvements in your physical condition and overall quality of life over time. We encourage every patient, under professional guidance, to gradually adjust their dietary structure and embrace a dynamic, healthy lifestyle. The journey to better health isn't instantaneous, it's built on every well-considered choice made at the table. May every bite of natural food empower you to secure a vibrant and stable future.